Earlier this year, Trinity Health Mid Atlantic underwent a rebrand among our medical group across the region. As part of this rebrand, it is my pleasure to introduce Dr. William Melms, the president of Trinity Health Mid Atlantic Medical Group. Today, we will hear all about the future healthcare at Trinity Health Mid Atlantic. I'm your host, Margie Zimmerman, and this is Beyond the Stethoscope. Hello, Dr. Melms. Thank you so much for joining us today.
Well, thank you, Margie, for having me here today. I really appreciate the opportunity.
And it's also a pleasure meeting you. So, Dr. Melms, you joined us in January as the new president of Trinity Health Mid Atlantic Medical Group. And I'm sure that these last couple of months have been very busy for you.
These last few months have been very busy, no doubt about that. As one might imagine, joining a new group like this, there's a lot of learning to do. I really appreciate what I've seen to this point. I've met a lot of great people. These people are mission driven and they truly care about our patients.
Yes, I totally agree with you. Dr. Melms, can you tell us a little bit about yourself and your background and where you came from and how you landed here at Trinity Health Mid Atlantic?
I will. I have lived in Wisconsin my entire life. Let me just say that first off. I went to the University of Wisconsin for medical school, did my residency in Milwaukee, practiced in Milwaukee for 11 years before moving up in northern Wisconsin to join the Marshfield Clinic Health System. For the past about 5 years, I was chief medical officer and executive vice president for the Marshfield Clinic. I have lived in Wisconsin all my life, as I mentioned. The very first time I was in Philadelphia or in the Delaware Valley was in December when I came to interview. But when I did interview, met Jim Woodward and all of the team members, I knew this is where I wanted to be.
That's great. So, how did you know? What sparked your interest and made you want to move here?
Well, it was a question that someone asked me during my interview, and they said, "What did I like about my previous situation?" And I said, "It was the people I worked with. It was what got me out of bed in the morning." And I could tell right away during the interview that these people that I was going to work with were exactly the same.
That is the most important thing. I totally agree with you there. And I'm glad you're here. Dr. Melms, thank you for sharing your background with us and your journey with us. Our topic today is the future of healthcare. There are many advancements happening almost daily. What are your thoughts on our current trends to make healthcare more digital? Can you give me an example of how digital technology is advancing in healthcare?
I could probably give several examples. Society is being digitalized. There's no doubt about it. So why wouldn't medicine become digital as well? And one example that comes to mind right away is robotic surgery. Robotics have been around since the mid 80s to early 90s. With innovation and improvements, robotics have really become in the forefront of the surgical operating theater. And in fact, almost every specialty in surgery can be using robotics now. What we find is that because of the smaller incisions, because of the better visualization, these procedures are more precise in many cases, leading to shorter hospitalizations, less postoperative pain, and improved recovery. So, robotics is here to stay. Another area is artificial intelligence. So, as we look at artificial intelligence, what can that do? And in medicine, what we will see is that artificial intelligence can examine a large quantity of data, analyze that data, and then ultimately come up with recommendations for treatment modalities. And this is going to be an area that's going to be exploding in the next few years for sure. There has been a program through the National Institute of Health, for instance. It's called the All of Us campaign. And the All of Us campaign is aimed at enrolling 1 million people into this study. where every aspect of their lives will be studied and entered into a data bank. And then that data bank will be able to be used by AI to determine patterns of health and health outcomes.
And where do they get these people from? Like, are there certain people that are
They
going
just get signed up.
wow,
There are participating organizations that just sign up patients to do this. And you have a blood draw to gather genetic data and a very in-depth history about lifestyle, behaviors, and medical problems.
well, this is fascinating.
It is.
Fascinating,
That's
really,
going to be
it
a
really is.
fascinating area, and it's really going to be prominent. And along those same lines with artificial intelligence is machine learning.
Mhm.
So one of the areas that we'll see machine learning is in oncology imaging. Very exciting stuff. So imagine that a machine looks at thousands and thousands of mammograms, normal ones and abnormal ones, and then learns what a normal mammogram looks like and what an abnormal mammogram looks like. With that experience that the machine develops, we will see that there will be very subtle abnormalities that the machine might pick up that the human eye would miss. And this is another area that we're going to see interjected in cancer screening.
That's wonderful. How many years do you think this will take place in?
The technology is already FDA approved. Right now, we're seeing it primarily at research institutes, but this will become the community standard probably at some point. It's not going to replace human beings, but it will augment what human beings do and will really help to improve the accuracy of mammogram reads, as an example.
That's great. Exciting stuff on the forefront.
It is.
Really is. What kind of digital initiatives have you implemented in your career that could benefit our practices here?
So innovation, I have to say, is always need-based. And when the pandemic hit us, a couple of things happened. One of those things was that our hospitals filled up. And so I had to stop elective surgeries that would require inpatient stays. Um, Patients didn't necessarily like that because when we call something an elective surgery, I'll put that in quotation marks. It's not really elective for the person who needs the surgery. So I worked with our orthopedic group and established an outpatient total joint program where we admitted these patients in the morning, did their surgery, recovered them, and then sent them out the same day so that they wouldn't stay in the hospital. Very well received by both our physicians, our surgeons, and the patients. And in fact, I was so impressed with this program that when I needed my knee replaced, I had it done robotically same day and was sent home the same day. And just to show that I was recovering well, I ran my first Teams meeting from the recovery room wearing my gown, just to kind of show off a little bit to my team that I was that dedicated.
That's great.
So that was a big one, and that stuck with us. Another area was I have to say that the labor crisis associated with the pandemic really hit rural communities hard, and all of my practices were in rural communities. So we partnered with a company that was using AI to help the support staff decrease some of the burden and make their lives more efficient. So ultimately, we wouldn't need quite as many support staff because we couldn't hire them. So we established a program where patients were able to provide their information, both clinical, administrative, and insurance information, electronically before they ever set foot in the door. So this really saved time for the receptionist, saved time for the medical assistants because they had already entered their medications, and very well received by our staff and by patients. It was a big satisfier for the patient to not have to fill out forms in the exam room. And then, like all other organizations, we had to ramp up telehealth. We had to ramp up and expand telehealth.
It's
The
a
other
good thing
thing
we
that,
had telehealth.
yeah, it was a great thing.
Really.
And then also what we did was there's another area of AI called natural language processing.
I have not heard of that.
And so I'll explain it to you.
Great. Thank
So
you.
one of the things that we've seen is that the medical record, the electronic medical record, is now about 20 years old. And it has failed us in some ways. The promise of the EHR was that it would improve patient care and it would make doctors' lives easier. If anything, it's made doctors' lives more difficult. Yes, and one of the reasons that it does is because of the documentation required. So natural language processing is in the process right now of being developed and being applied. So your device in the exam room will listen to the conversation that a doctor has with a patient and then take that conversation and turn it into a document that makes sense. So it's not just simply a recording, it gets engineered, put into a document, makes sense, and will save that physician a lot of time in documentation.
It's probably very accurate, I assume, too.
Very accurate, and it's becoming more accurate too. So I piloted that in my old practice, and in fact, here at Mid-Atlantic, the same organization that I used has been engaged to start this as well. So I'm very excited
Oh,
about
when will
that.
they implement this?
It's being implemented currently.
This is great stuff.
Yes.
That's great. Outside of the digital landscape, what goals are you hoping to achieve with the medical group for the rest of the year?
One of the things that I noticed when I first got here, and the first day, I set myself one day before I started the interview, and I said, I'm going to drive to all the hospitals. And I did. I'm thinking, wow, that was a lot of driving in traffic. But what I found was, as I got here and started meeting people and touring the facilities, was that we had, in many ways, four separate cultures going on and very distinct cultures. And that's to be expected. Healthcare is delivered locally, so we will expect some of that. But what I really want to do is I want to unify this region so that it is understood that we are all Trinity Mid-Atlantic. I think that what we've seen is that in the separate areas, people recognize the hospital, but they don't recognize that it's Trinity Mid-Atlantic, and I want to change that. I think that as we strengthen the brand, then we strengthen all of the hospitals and we strengthen all of the practices associated with that brand. We're going to unify what quality looks like, quality metrics. We're going to do that. Unify policies. I really want to do that as well. So, that's much of what we're going to do. The other area of focus I have is on recruitment. We have a lot of work to do with that. We're going to revamp the recruitment department and make sure that we have recruitment adequate to provide for our expanded services and to make sure that we have adequate capacity for our patients.
It's much needed. I appreciate you doing that. What would you say excites you the most about the field of medicine in the next 5 years? I think you've already talked about some of it.
Well, first of all, 5 years is an absolute eternity when we think about what medical innovation looks like. But, think about what we've seen so far. When you turn on the TV at night, you see these advertisements for commercials or the commercials for new drugs. And first of all, let me say I'm opposed to advertising prescription medications. However, many of these drugs that you don't get a sense of are based on profound innovation, especially the drugs for inflammatory arthritis, like psoriatic arthritis and rheumatoid arthritis, inflammatory bowel disease. They're based on monoclonal antibody technology, just really tremendous. We're going to see more of that. We've seen significant changes over the last 20 years or so in cancer therapy. There's been greater than 25% decrease in mortality in cancer over the past 20 years. We're going to see more of this. The pandemic really reset the paradigm on vaccination development. So the COVID vaccine was incredibly innovative, and we're going to see new vaccines on the heels of that. Most recently, we've seen it with the RSV vaccine for adults, which is going to save thousands of lives. So very excited about those things. We're going to see more in the way of surgery, further advancement in robotics. We've seen neurosurgery changes, brain implants for epilepsy and Parkinson's disease that have been miraculous. And then finally, I guess what I want to say is that we go back 70 years, and 70 years ago was when the structure of DNA was determined. Then 50 years later, in 2003, we had the Human Genome Project was completed. So the Human Genome Project was to try to determine all of the base pairs that make up human DNA. So 3 billion base pairs were determined that made up human DNA. So then the question was, how can we use that information? In 2017, the first gene therapy was approved, and this was approved to treat a type of B-cell lymphocytic leukemia in adults and children. And we have seen other gene therapies arise. Most recently, the FDA approved in December of this last year, therapy for sickle cell anemia that really has the potential to change and improve the lives for the estimates in this country, 70,000 to 100,000 people with sickle cell anemia. This will change lives profoundly, and we will see more on the horizon. This, though, latest treatment for sickle cell anemia also illustrates a point that it has to be reckoned with, and that is the cost of innovation. All of these meds that you see advertised on TV are incredibly expensive. Gene therapies are incredibly expensive. And in fact, the treatment for sickle cell anemia, for one patient, the current cost is $2.2 million for one patient. Multiply that by the 70,000 or 100,000 patients that could benefit from this. And I'm not sure that we have enough money in our economy to do this. But we'll see. That's something that society is going to have to reckon with.
It's a shame because there's so much out there, but again, the cost of treatment for a lot of these, for this innovation, a lot of people cannot afford.
True.
Well, thank you so much for joining us today, Dr. Melms. This has been a wonderful interview. It's a pleasure meeting you, and we look forward to your leadership to take us to the next level at Trinity Health Mid-Atlantic.
Well, thanks for having me on, and I love being here.
It's a pleasure having you here. Thank you so much. To learn more about Trinity Health Mid-Atlantic Medical Group, please visit our website in the description below. Thank you all for joining us today. Please be sure to subscribe for future episodes of Beyond the Stethoscope.